Hi guys, Joe Giacobello here. Today I'd like to talk to you about lingual nerve injury. Now, back in 2011, I went in for a routine dental procedure and I sustained a horribly painful injury to my tongue, the effects of which lasted for over 2 years. Now, what's a little disturbing about this is that this could happen to any one of you anytime you go into the dentist's office and they shoot that Novocaine into your mouth. I remember when the dentist was shooting the anesthetic into my lower jaw to do a nerve block. I remember feeling a horrible, quick, sharp jolt of pain. And then I remember my tongue feeling really dry and hot and dry. And it was like that during the entire procedure that he did. I went home that night. The next morning I woke up. And when I woke up, my entire mouth, my jaw, my tongue was completely numb. That feeling of numbness that you have when you're at the dentist's office after they've shot you with Novocaine. And I thought, how could the anesthetic not have worn off after all these hours? I was quite alarmed. Well, it took quite some time for that feeling of numbness to go away. And when it finally did, it was replaced by a lot of other horrible feelings on my tongue. There was a feeling of numbness on the tongue and a little bit on the lower left jawline and gums. There was a feeling of tingling. There was excessive salivation. It just felt like I was salivating constantly and I couldn't swallow enough of it. It was just constant salivation. Really weird stuff. There was feelings of pins and needles poking my tongue, intermittent shooting pains in the tongue, a feeling of burning almost constantly. When I spoke, it caused vibrations that actually caused pain in my tongue. And at the time, my speech was actually slurred. I couldn't speak clearly. And when I did speak, it actually kind of hurt. There was a sensation of a slimy coating covering my tongue and the inside of my mouth. Some of the strangest things was the electrical jolts and pangs. It felt like there was electrical jolts in my tongue. There was a feeling of tightness and constriction of the tongue. And the tongue always felt tired and weak, and it was tight and raw and sore feeling. It felt like someone was clamping the front of the tongue like with a pair of pliers, just holding onto that very tightly. Brushing my teeth was painful and caused burning. When I ate, it hurt. It hurt to eat. Anytime I touched anything on my tongue. I remember telling somebody that it actually hurt when I would lick an envelope. That was very painful. So basically this went on for a couple of years. With time, most of this went away. I say most because it's years later. It's many years later now. And if I drink something hot, if I drink hot tea or eat soup or whatever, it starts that burning on the tongue. But I am just thankful that most of the horrible stuff went away. I would say that 92% of the symptoms basically went away over time, but it took a long time. There's a nerve that runs into your tongue called the lingual nerve, okay? If the dentist happens to hit that nerve with the needle, you will feel a jolt. And I understand that this does happen quite often. Now, if he continues at that point to shoot the anesthetic into the nerve, that's where you could run into some of the problems that I had. One of the reasons my situation was so bad was because of the anesthetic that the guy used. He shot me with an anesthetic called Citinest. That is the same as Prilocaine, 4%. I later found evidence online in more than one place that anesthetic, Prilocaine, is much more likely to cause problems than other anesthetics, such as lidocaine. A Canadian study showed Prilocaine to have 15 times greater frequency of paresthesis with mandibular block anesthesia compared with lidocaine. The article recommends that prilocaine and articaine not be used for mandibular block and lingual block anesthesia. So ask your doctor what kind of anesthetic he's using to shoot you with. It is your business. Okay, so let's talk about the lawsuit. Let's talk about all the money that I was awarded for all of this pain and suffering that I endured over those couple of years. There was not a penny of compensation, actually. I contacted several lawyers and nobody would take the case, and here's why. I was told that when it comes to needle injuries, needle-related injuries, dentists are protected. They're highly protected, and here's why. When they're shooting that anesthetic, they are shooting blindly. They don't know where that nerve is. They don't have any way of knowing. They are just shooting and hoping not to hit that nerve. And so it is not considered their fault. And I understand that. I do. So anyway, if you do happen to get an injury such as this, you're certainly not going to get a penny for your suffering.